Med History.
Siamese twins are identical twins who are connected to each other in certain areas of the body. Pathology occurs if, during early embryonic development, there is no complete separation of the two embryos, so some organs remain common to them. Diagnosis is possible even in the antenatal period with the help of fetal ultrasound, MRI, measurement of the level of specific hormones, and chorion biopsy. After the birth of children, the examination is aimed at identifying the degree of fusion and developing a treatment strategy. Under favorable conditions, it is possible to separate Siamese twins, after which they live a full life. The true causes of embryo formation disorders have not been established. Probably the violation of tissue differentiation is provoked by the same factors that cause other severe malformations. Only in the case of Siamese twins, adverse causes begin to act soon after conception. Obstetricians, gynecologists, and neonatologists name several typical etiological factors, including the age of the mother. Siamese twins, like other severe congenital anomalies, are more likely to be born in women who become pregnant after 42 years, especially if this is the first gestation. Early motherhood, under the age of 18, it is also attributed to predisposing factors. Gynecological diseases. Violations of the anatomy of the embryos can occur with congenital or acquired deformity of the uterus, the presence of chronic inflammatory diseases of the genital organs. Less often, the cause of the birth of Siamese twins is an extragenital pathology. Teratogenic factors. Adverse effects on the body of a pregnant woman in the first weeks after conception cause genetic mutations and developmental abnormalities. Among the teratogens, there are physical, radiation, chemical, atmospheric pollutants, drugs, nicotine and alcohol, biological, viruses and bacteria, related marriages. Siamese twins are a more common phenomenon in some Asian countries where sexual relations between relatives are still allowed. The risk of defects in the fetus of incest is doubled. Siamese twins are a rare anomaly that is registered one time per 200,000 births. It is more common in newborn girls, up to 70–75%. This name of the birth defect was formed thanks to twins born in Siam, Thailand, who performed in circus acts and were known all over the world. Despite the rarity, the problem is relevant in modern pediatrics, as surgical techniques are being improved, and it is possible to save the lives of an increasing number of children with similar abnormalities. In practical medicine, Siamese twins are divided into several subgroups, depending on the way the children grow together. This is important for determining the prognosis, since in some cases it is possible to safely separate newborns, and in others, surgery is not performed due to 100% mortality. The main variants of Siamese twins, thoracophagy, the most common type of pathology which occurs in 35–40%. Children grow together in the chest area, while the heart is involved in the process, so the chances of a successful operation are low. A subspecies of thoracophages are xiphophages, when fusion occurs only by the cartilages of the sternum, omphalophagi. They make up to 34% among all types of Siamese twins. Fusion is noted in the abdominal area and the lower part of the chest. Often children have a common digestive tract and liver, ileophagy. It is detected in 19% of cases and is characterized by complete fusion of tissues back to back, including the buttocks. The presence of one spinal cord for two is considered especially unfavorable, ischiopagus. It is observed in 6% of newborns with this pathology. They are connected in the lower limb girdle area. In children, one large pelvic ring is formed, including two sacrum and pubic symphysis, paraphages, a complex type of fusion, which is registered in 5% of children. The connection occurs side by side. Sometimes the pathological process affects the heart, liver, and other vital organs. Craniophagus. In 2% of cases, there is a connection between the heads with separate bodies. Parasitic craniophages are isolated into a separate subspecies when there are two heads on one trunk, but one of the twins does not have its own consciousness. The main theory of the formation of conjoined children is the violation of the embryonic period and the late division of the egg. Normally, with the development of identical twins, the zygote is divided on the 6th day. In the pathological variant, The separation of embryos occurs 2 weeks after fertilization, when the initial stage of tissue specialization and differentiation occurred. As a result, two organisms cannot exist separately, since they share some of the same germ tissues. Diagnostics. In modern obstetrics and gynecology, the question is raised about the earliest possible detection of Siamese twins, preferably during the first trimester. This gives the doctor and the expectant mother the freedom to choose whether to maintain or terminate pregnancy, and also helps to adjust the tactics of a woman's management and create conditions for proper preparation for childbirth. For the intrauterine diagnosis of Siamese twins, the following methods are used. Ultrasound of the fetus. At an early stage, sonography is performed transvaginally so that the doctor can assess the structure of the chorion, the presence and configuration of the fetal egg, and identify signs of abnormalities in the development of embryos. In the second and third trimesters, ultrasound is performed only transabdominally, so as not to provoke uterine hypertension. MRI. A targeted examination of the pelvic organs is prescribed if an ultrasound specialist suspects the presence of Siamese twins. Magnetic resonance imaging is performed without irradiation of the woman's body, therefore it does not pose a threat to the fetus. Chorion biopsy. Invasive diagnosis is indicated if a hereditary or spontaneous genetic mutation is suspected, which caused a complex of defects, including incomplete separation of fetuses. The obtained material is used to study the chromosome set. Laboratory methods. For the prenatal diagnosis of the pathological development of twins, the doctor needs the results of a study of human chorionic gonadotropin and plasma protein A. The tests are performed in the early stages of pregnancy, when it is impossible to do a chorion biopsy. The name comes from the twins Chang and Enga Bunker, who were born to Chinese parents in Siam, now Thailand, lived for 63 years, 1811 to 1874, were married to sisters and had healthy, normally developed children. The frequency of this malformation ranges from 1 in 50,000 to 1 in 200,000 pregnancies. The reason is the incomplete separation of the organisms of identical twins in the early period of embryonic development. In about half of the cases, Siamese twins are stillborn. Treatment of Siamese twins. Thanks to the improvement of surgical techniques, surgeons are now taking on the separation of Siamese twins who do not have life-critical defects. In some cases, doctors face serious moral and ethical problems, especially when one child is doomed to die in advance during surgery, or the probability of a successful outcome is extremely low. Medicine has known cases of success of such operations, but this issue requires further study. Another moral dilemma is the ethics of performing an abortion if the presence of a defect is established in the first trimester. In countries with legally permitted medical termination of pregnancy, such manipulations are carried out if a woman refuses to bear children with severe abnormalities. At the same time, the improvement of diagnostics comes to the fore so that it is possible to detect the problem in a timely manner. Prognosis and prevention. Previously, the mortality rate of Siamese twins reached 99%, but as surgical techniques improved, this figure decreased. The prognosis primarily depends on the type of fusion. The fewer common organs children have, the easier it is to perform surgery and the greater the chances of its successful outcome. The prevention of pathology consists in the exclusion of teratogenic effects on women of childbearing age, medical and genetic counseling for couples with a burdened family history.